John and I are back in the health studio to dissect some more content. So John, we just watched 2 incredible sessions, including an inspiring conversation on maternal health inequities. Christy, Fran, and Robyn mentioned a pretty ambitious but important wish list of policy changes around maternal health. As a physician and father, I'm sure a lot of this probably hit home for you. So would love to get your thoughts on how the pandemic exacerbated the already terrible outcomes in maternal health. And knowing that we can't always rely on political leaders to enact change, how can the health industry step up to improve the current state of care for maternal health?
Yeah, it was a really inspiring session. I mean, they mentioned the shameful state of maternal mortality in this country. You know, we have the worst maternal mortality rates in the developed world, and COVID has disproportionately affected Americans of color. And we consider that Black and brown women have already had 3 times more likely to die during childbirth prior to COVID. This just underlines the need for action. I mean, we need to reiterate the importance of implicit bias and cultural competency training to close the maternal mortality racial gap. I think that the research findings that both young women and their providers feel that they want to connect more digitally, but aren't sure how, underlies that we still have so much more work to do in expanding telehealth access and to reach communities who may not be able to access, us virtually. They talked about postpartum period and 4th trimester, and especially with COVID restrictions, this would be a great time to be able to stay in closer contact with new mothers. This idea of coverage and full reimbursement for telehealth and for remote monitoring devices that enable telemedicine is something that our group at Boston Children's has been thinking about. But there's just still so much work to do to close these sort of massive disparities that exist. And it really reminds us of the need for broader policy changes and the action now to fundamentally change how we're delivering care and reaching people that need it most. And this is why we're so enthusiastic about some of these digital innovations that we're investing in and piloting. So yeah, a lot of enthusiasm going forward to correct some of these massive structural challenges that we have in our health system today.
Yeah, for me, I just loved hearing 3 really powerful female leaders talk about it, and Lena Wen, of course, is amazing as well. So,
incredible.
Yes, thanks so much, John. Really enjoyed spending time with you. We'll have to catch up with you after the event on a blog or podcast, but thank you so much for sharing your time.
Thanks so much for having me.
Have a good one. Our last keynote of the day can't be missed. Join us in watching a candid conversation with none other than Venus Williams.